Good afternoon. Welcome to the daily briefing at St. Clair County EMA, where we're joined with Chairman Mark Kern and our friend Sam from the Health Department with the numbers again today. And it's good to be back.
Yes, it is. So as of today, 62,232 St. Clair County residents have been tested, which is an increase of 982 from yesterday. That does include 5,850 positive test results, which is an increase of 56 from yesterday. And that does include both males and females from their teens up to their 80s. And our county daily positivity rate today is 5.7%. We are at 57,382 negative test results, and we are currently still at 174 deaths. It's always a good day when we have no new additions to that category. And as of today, we have 5,031 that have completed the IDPH required 10-day isolation period. And for the state, we are at 4,064,161 that have been tested, with 235,023 positive test results, which is an increase of 1,668 from yesterday. And for the state, they are reporting 8,026 deaths, which is an increase of 7 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, currently 43 patients are admitted due to COVID-related reasons, and 4 of those individuals are on ventilators. For our regional hospital numbers, we have 100 patients that are admitted due to COVID-related reasons, and 14 of those are on ventilators. And remember, the St. Clair County number that we give you is included in the regional number. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, we are going to give you the updates for any changes in our facilities. Lebanon Care Center is at 66 cases and 12 deaths, which is an increase of 4 cases from yesterday. And Mercy Rehab and Care Center in Swansea is at 10 cases and no deaths, which is an increase of 1 case from yesterday. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we'll move into the zip code report for today. Remember, these are COVID positive diagnoses in these particular zip codes, and they are cumulative from when we started this whole thing, or at least when they started keeping track of the zip codes, which probably is in March. So 62059, we remain at 11. 62201 remains at 220. 62203 remains at 177. And 62204 remains at 127. 62205 is also at 177. 62206 goes up by 1 today to 404. 62207 goes up by 2 to 230. 62208 stays the same at 348. 62220 goes up by 1 today to 458. 62221 goes up by 3 to 557. 62223 goes up by 1 to 331. 62225 stays the same at 23. 62226 goes up by 3 to 618. 62232 goes up by 1 to 150. 62239 stays the same at 80. 62240 stays the same at 27. 62243 goes up by 1 to 76. 62254 remains the same at 193, as does 62255 stay the same at 15. 62257 stays the same at 31. 62258 goes up by 1 to 136. 62260 goes up by 1 to 98. 62264 stays the same at 84. 62269 goes up by 3 to 449. And 62285 is static at 62. The regional positivity today, according to the state and their number system, is 10.4% today. So, but as we register our daily county positivity rate, it's 5.7%. Herb?
Numbers. Did I ever tell you I dislike them? We live and breathe it as we tell everybody every day. The mask giveaway that we did, a few more communities still have to pick theirs up. We got a couple of calls today from Swansea residents, and we've been in touch with them, and they're making arrangements to get them picked up today. So that's went pretty well throughout the county.
A lot of logistics to disseminate 500,000 plus masks into the community.
Well, and as we said the other day, we couldn't do it without the cooperation from the communities and the townships, getting it out of there, making it to where the citizens can get it, because there are some that can't get out and get them. So some of the communities have come up with some ways of making sure that they're being dispersed to the communities, and we really appreciate that. We talk about numbers as we look at them. We know we got a holiday coming up, the Labor Day. That's going to be another proof in the pudding, as I like to say. We saw it through Memorial Day and the 4th of July, and here we are at Labor Day. So I just hope everybody takes heed of warning. We got to practice that social distancing, physical distancing, wear the mask, wash our hands. I said it a couple times now with the last 170 some days. Team St. Clair, I can't say enough of all of you that have spread the word. I see you sharing it around, and I see new people following the page and putting their 2 cents in, and we appreciate that. For those of you who still haven't understood that the best precaution we have is the mask. You wearing it when you're out, and people you're around, we can help slow this thing down until we get the vaccine, whenever that's going to be. But if we don't, we're going to be here. And I read those messages the staff here does throughout the evening. We try to answer them. I saw one from yesterday, somebody saying, oh yeah, they're going to shut things down before Labor Day. Well, who in their right mind wants to shut businesses down? I mean, there's not a community out there, there's not a mayor out there, there's not a business out there that wants to shut down. And so all of the business owners are trying to do their best, and we are getting more reports. We're actually now seeing people call the EOC and saying, I went by such and such a business, and the employees had their mask on, and people coming in had their mask on. So it's kind of the opposite.
Yeah, we get reports, positive and on the negative side.
Yeah, so that's what we want.
Illinois Department of Public Health is looking at the numbers that they have put together, and they're doing this based upon what they believe is best to slow this virus down, to get it to a level more like what we're seeing in other states, which is around 3% level. That's really where it needs to be for people to be feeling comfortable being out in the public.
Well, and then, as I said, we can do it together. Team St. Clair, that's kind of what we named this, because it's fighting that invisible enemy, and it takes all of us to do it. Not one person can do it. So let's continue to move forward, and let's show this terrible virus that we can all hang together and take care of it. We'll be back momentarily with the ladies to address us into the Spanish communities, and then we'll be back tomorrow afternoon with the next update. Have a good evening.